Hi, I'm Rosemary Clee, the Executive Director for the Bergen Newbridge Medical Center Foundation, the fundraising arm of New Jersey's largest not for profit hospital, and the sponsor of In the Know It Row, an informative conversation with leading clinicians on important health topics. Today I'm joined by Adrienne Mariano, Senior Director of Behavioral Health at Bergen Newbridge Medical Center. Adrienne is a licensed professional counselor who has been in the mental health field since 2005. PTSD, post traumatic stress disorders, in veterans is a serious issue, but many former military members and their loved ones do not know how to identify the symptoms. PTSD affects mental health. It can be hidden, often due a sense of shame because there is such a prevalent stigma. Health practitioners and other individuals may find it difficult to diagnose and gauge its severity. Additionally, it is often misunderstood that the condition only affects combat veterans or those who have encountered violence firsthand. Even those who understand PTSD in veterans still may not know all of its wide range symptoms and its potential long lasting harm because not all veterans have the same symptoms or react the same way. Today, Adrienne Mariano will discuss with me some of the symptoms, treatments, and how we can support our veterans. Thank you for joining us today, Adrienne.
Thank you so much for having me, Rosemary. And I understand that this is an important day because this is PTSD awareness. So I'm glad to be talking about this subject. It's really important for us to get the awareness out.
It is, it is. So can you tell us what is PTSD?
Sure. So PTSD, or post-traumatic stress disorder, it doesn't look the same for every single person. It's a psychiatric disorder that might occur in people who have experienced or witnessed a traumatic event. So it can be a natural disaster, it could be a serious accident, a terrorist act, war, combat, sexual assault, or people that have been threatened with death or violence. So about 6 out of every men or 5 out of every 10 women experience at least one trauma in their lives. And just a little bit of background in history. PTSD became a mental health diagnosis in the 1980s and was added to the DSM, which I kind of talk about in other in the Know with Rose that we've done. That's the clinicians and our physicians handbook of all diagnosis. So during that time, it became a diagnosis with influence from a number of social movements, such as the feminist, and Holocaust survivor advocacy groups. And research about veterans returning from combat was a critical piece in this to the creation of the diagnosis. And you can actually find a lot of descriptions about PTSD before it became an actual official diagnosis from literature. So the Iliad, which is written by the Homer, William Shakespeare also written Henry IV, and Charles Dickens. You can find that in A Tale of Two Cities. And a lot of people often have heard of shell shock, and that was a term coined by a British psychiatrist. It was kind of a loose definition before the DSM-4 came out. Um, and that was basically talking about the symptoms that we see now, but it really attributed these symptoms to people that had a moral failing, an issue with their moral fiber, and they wouldn't be able to handle combat, and that's why they developed these symptoms, which is really wrong. That we're going to be talking about stigma later on. And also now, we can kind of see the war in Ukraine bringing up triggers for veterans as an example of what many veterans are experiencing right now.
So what are some of the signs and symptoms that we might see?
So again, PTSD symptoms really don't look the same for every single veteran. They usually start soon after the traumatic event, but they might not appear for many months or years afterwards. They can also come and go over the years. And if symptoms last longer than about 4 weeks, they can cause you a great deal of distress or interfere with your work or home life. You might be developing symptoms of PTSD. And there's roughly about 4 types of PTSD symptoms, and one of them can be reliving the event, so re-experiencing symptoms. Memories of the traumatic event may come back at any time, and they also feel very, very real. So some examples can be nightmares, flashbacks, And you might be triggered by things that you see, hear, smell, or taste that cause you to relive this event again. A lot of our senses really do trigger those things. A second symptom could be avoiding things that remind you of the event. So trying to avoid situations or people that remind you of what the traumatic event was. You might even be avoid talking or thinking about the event. And this could be used as a coping skill, but it could be very detrimental to recovery if you're not touching on what happened and you're not talking about it and bottling it up. So that can be very problematic for the person suffering. Also, having more negative thoughts and feelings than before the event. So the way you think about yourself and others might become more negative because of the trauma. So you might feel more numb, unable to have positive or loving feelings towards other people. You might also lose interest in the things that you used to enjoy. You also might forget parts of the traumatic event or not being able to talk about them at all. That's kind of dissociation. You also might think that the world is dangerous and no one can be trusted. That can develop into paranoia. You also might even feel guilty or shameful about the event, wishing you've done more or kept it from happening. This can also be survivor's guilt. Maybe you have lost people in combat or during a traumatic event, and you're guilty about surviving that. And then lastly, feeling on edge or keyed up. So it's also called hyperarousal. You might be jittery or always on alert and looking out for danger. You might also be suddenly angry or irritable. You can develop symptoms of insomnia, feeling like you can't concentrate, startled by a loud noise or surprise, and you might even act unhealthy. So you might be starting to abuse drugs or alcohol, even driving aggressively or acting impulsively.
So, how does post traumatic stress disorder affect veterans?
That's a really good question. So, when you serve in the military, you can be exposed to different types of traumas than civilians. The war you served also affects your risk because there's different types of trauma that were common. So, some people might have trauma that they had stepped on an IUD or someone that they were in combat with did. Other times it could be just a lot of violence. So, it depends on what situation that you're in. So, war zone deployment, training accidents that I kind of touched on, military sexual trauma may lead to PTSD. It's also linked with TBI or traumatic brain injuries. It's also linked to PTSD. So, the number of veterans with PTSD varies by your service area. So, Operation Iraqi Freedom and Enduring Freedom. So, about 11 to 20% of veterans suffer from PTSD in a given year. The Gulf War or Desert Storm, this is about 12% have PTSD or have developed it within the past year. And the Vietnam War, about 15% of those vets are currently diagnosed with PTSD. And there was the last study that was done in the 1980s, the National Vietnam Veterans Readjustment Survey. They estimated about 30% of Vietnam vets had PTSD within their whole lifetime. And I just want to kind of break down some of the things that you could see in vets that are linked with PTSD. So depression, drug use, and suicide are all increased if there's a traumatic event leading to PTSD. So touching on depression, results from a large national survey study that depression is nearly 3 to 5 times more likely in those with PTSD than those without. Substance use is big and linked with PTSD in veterans. So studies show that PTSD and substance use problems are strongly related in military and civilians groups. And some people try to cope with PTSD symptoms by self-medicating with drugs. So more than 2 out of 10 veterans with PTSD have a substance use disorder. And almost 1 out of 3 veterans seeking treatment for substance use disorders also have PTSD. And in the wars in Iraq and Afghanistan, about 1 in 10 returning vets are seen in VA hospitals with problems with alcohol or drugs. And they typically see war veterans with PTSD engaging in binge drinking. Suicide is also something that has to be closely looked at. And if veterans are suffering from PTSD, suicide risk increases with that. So overall, it really mimics the general population. Overall, men are more likely to die by suicide than women. Also, from 1999 to 2010, the average suicide rate among US males was 19.4 out of every 100,000, compared to 4.9 out of every females. And this really mimics the same statistics for veterans. They also found that um, feelings of loneliness and isolation and feeling like a burden can really contribute to suicidal thoughts. They also found that more homeless veterans suffer from suicidal thoughts or attempts. And out of these attempts, there's over 69% of those attempts are used with a handgun, because veterans do have they have access to guns just given their position.
Wow. So, how can stigma affect the veterans from getting help?
I kind of touched on that earlier. So, the whole shell shock thing was really based on a lot of stigma, feeling like that's a moral failing for giving up and not being strong because, when you're in the military, you're supposed to act as if you're strong. So, a lot of the veterans do not want to just ask for help. Stigma involves negative attitudes that people have about mental illness, and others experience self stigma. So you feel shame or guilt about having PTSD, and you might not want your friends, your family, your employer to know that you have it. So, when individuals are in active military service, the stigma surrounding help is really strong within the culture. So, many service members fear that if they access mental health treatment within the military, then they endanger, their job security, their security clearance, and even separation from the military. So there's a new agenda kind of being put out about, stigma. So an anti-stigma campaign was launched by the Department of Defense. It's called Real Warriors, Real Battles, Real Strength. So I really like that title because
Me
it's
too.
really trying to support our vets getting help. And this is designed to change the culture of not accessing mental health services. And for women in the military, the stigma is experienced in other ways. So, women serving in the military roles, they face discrimination when they're first enlisted because there's still a traditional type of role belief that women should be working on the front lines, they shouldn't be in combat roles. So if they're single women, they're looked at as if they're promiscuous, or if they're married, they're looked at as if they're neglecting their family. And that's just simply not true. And if a trauma happens within the military, such as military sexual assault, they're often bullied or they're often faced with inappropriate behavior by others not to report. So they're suffering in silence at this point. And many women just don't feel comfortable accessing mental health treatment because of those reasons. There's now talks within the UN to remove barriers of discrimination against women soldiers and veterans by providing safe outlets to report abuse without experiencing the stigma there.
So, how can we help? How does PCA? Oh, good goodness! I'm sorry. How does PTSD affect families?
So the family system is, of course, affected very deeply by this. The family system is constantly changing from the moment that the person is deployed until that they come home. So when they leave for service, the family has to kind of have to shoulder most of the burden on keeping the household up to date while the person is in combat. And when they come home and they have experienced a trauma, the family then has to change too. So it's very easy to get confused and not realizing the situation, and the whole family dynamic has shifted since the veteran has left. So the stress of the veteran returning home has some common symptoms, so such like as sleep problems, dissociative symptoms that we touched about, anger, and just having a really hard time adjusting to civilian life. Families, a lot of the families have reported increased substance use in themselves, aggression, violence, and children reacting to the veterans, seeing them firsthand experiencing the symptoms, can in turn show the children what's going on, and they might not understand what has happened if a person has been deployed. So the children watching their loved one have these PTSD symptoms, and sometimes they can be quite scary and they can be quite severe. They might develop some secondary trauma and develop some PTSD symptoms themselves. So we all need to really take care and really be in the know about what's going on with the veteran and being able to support them. So the trauma from witnessing it is also something that affects the families as well.
So, what kind of treatments are available to help the veterans?
So there's an enormous amount of treatment. So it's important to discuss this obviously with your doctor about any medication. So I'm not going to make any recommendations about that, but some specific therapy modules are available. And the VA actually has some mobile applications where you can access these types of treatments on your phone. So if you are a vet and you're looking for services, they make it quite easy. And you can just search within your local area to see if there's somebody that provides these types of therapies. So I'm going to go over a few of them that have been evidence based, and they have shown great promise for our veterans. So one of them is the written narrative exposure therapy. So exposure therapy is really getting in there and writing about trauma in sessions. So this is something that's kind of abstract, but it's supposed to be able to be an empathetic environment to get this stuff out without, kind of basing it all on regular talk therapy. The second one is brief eclectic psychotherapy, and that's pretty self-explanatory. So it's supposed to be a brief psychotherapy and using different things from different types of therapies all in one. So not just focusing on one type of therapy, you're using kind of other things. So that can include mindfulness, relaxation. It can be recalling the details of the memory and reframing those negative thoughts that surround that memory, really addressing that trauma. The third one is narrative exposure therapy. So that's developed for people who have experienced a trauma from life to birth, and then taking that into present day and really putting that together into a story. So it becomes more personalized. It's not like a strict type of therapy. You're not sitting on a couch and you're talking about Freud and things like that. This is something to really address that type of trauma and seeing how that plays out from birth until present day. So you have to unlearn some things that weren't good coping mechanisms there. And then specific cognitive behavioral therapies, CBT, cognitive behavioral therapy, is used in a wide variety of different reasons and different symptoms. So that's helping changing unhelpful thoughts and patterns that people are having. And again, the VA offers these programs, so you can always search them if you are a veteran. Bergen-Newbridge actually has taken this on quite a long time ago, and they offer help to veterans, not just with behavioral health, but substance use and medical follow-ups, because we see that there's a lot of comorbidities for our vets. So they're not just dealing with the PTSD or the depression, they're dealing perhaps with substance use issues. They have a lot of medical follow-ups that they need to make. So the Veterans Access Line here at Bergen-Newbridge is 201-225-7189. And the Veteran Suicide Prevention Hotline is going to be really important too. So that is 800-273-8255.
These are all really great resources. How can families support veterans and post-traumatic stress disorder?
So families can support veterans by learning more about PTSD, to understand why it happened, how it's treated, and what you can do to help. Supporting the veteran is going to be really important, providing an empathetic environment and just a place to hold space so that they feel like they can go to you so that they can talk about their experience. But also, you need to make sure that you take time for yourself. Self-care is really important if you're involved with a vet and they're part of your family, because like I said before, PTSD just affect the veteran. It is affecting the whole family dynamic. And if you're a caregiver, that can be quite stressful, and you might even develop your own mental health issues that you need to be able to address yourself, because if you're not addressing it within yourself, you can't help anyone else. So it's really important to really be aware of what's going on with you. So some good tips are to learn as much as you can about PTSD. Offer to go to a doctor's visit with your family member if they're okay with it. You can be there for support, and that's really important. Tell your loved one that you want to listen, and you also understand if it's not the right time. Some people need a little bit of time to really get adjusted, and some people are afraid to talk about mental health, depression, or even suicidal thoughts with their family member because they think that by suggesting suicide or talking about suicide that you're going to make it happen somehow. That's simply not true. That's a myth. And we've talked about that in the Know with Rose. So I like how this all kind of comes together sometimes when we talk about different subjects. So it's really important that you don't think that you're causing someone to have suicidal thoughts. They're already going on within them, but you're able to provide that space for your loved one to able to express themselves. And want to be able to get treatment. You can even plan family activities together to try and reintegrate them back into the community, and encouraging contact with family and friends to create a support system. So, like I said before, feeling like a burden and feeling isolated are some of the contributing factors to veteran suicide. So, creating that support network of people showing their support, showing that they're around to help, is really going to be important to help with these PTSD symptoms.
How do we know, though, how much we should push the subject? Sometimes, you're talking to your loved one and they're acting out or they're having these moments. And, how do you know when to say, okay, I'm going to walk away now, but yet show that empathy and that loving support? There's definitely a fine line. Am I correct in saying that?
Yeah, there's always a case by case basis. You have to base it individually on what's going on. Obviously, if there is a situation where you're unsafe, then you have to address that immediately. If they're acting out in suicidal or homicidal thoughts, you have to call the police. In Bergen County, there's always 201-262 help, and they can come out and assess the situation. So safety is always paramount. If you are trying to talk to your loved one and it might not be the right time, you can always have a conversation with your loved one and preface what you're saying as, it might not be the right time, but I just want you to know that I'm here for you. You can't force people to talk. It's not going to happen, no matter how old the person is. So trying to force a conversation, it's probably not going to happen if they're not ready at that point. But being able to share resources and, if you've done some research and you found maybe someone that they can talk to, you can always provide that information. It's going to be up to the person to really to say yes to getting help.
And that I'm going to close with that. That's really great advice. I mean, being the supportive ear and giving the person the resources. Sometimes they don't know even where to start, and that's what the
Yeah.
biggest issue is. So I want to thank you so much for taking the time to talk about this really important subject on this post-traumatic stress disorder day. And if you'd like to learn more about our Veterans Hotline and Bergen Newbridge Medical Center, please visit us at newbridgehealth.org. And of course, if you'd like to support our foundation, please support us at newbridgehealth.org/foundation. And thank you again so much, Adrienne, for joining us today.
Thank you for having me.
Thank you. Take care.